Thank you so much for joining us for today's Heart and Mind Harmony panel discussion. I am so excited to be here with Delaney Stewart, I'm so sorry, and Dr. Kacie Deters. And I mean, this is such an important conversation. It's going to be all about how heart health, brain health, all intertwine and work together when it comes to mindfulness and wellness, right? Yeah, so before we get started, could you just kind of give me a brief overview of your background and who you all are? I mean, I know that you're amazing and you just shared your resume with me and I've read all about you, but I would love if you could tell everyone who you are.
Sure. Thank you so much, Lauren. So I am Delaney Stewart. I'm a registered nurse, and I'm currently the Director of Diversity, Equity, and Inclusion for the Alzheimer's Association, our California Southland chapter. And so I've been a nurse for a very long time. I work in what I call the aging population. So aging is my specialty, and I tell people, you're aging all the time. And so I began to work in this area many, many years ago, and then segued into the Alzheimer's and brain health space because that just naturally correlated to what I was doing. And so I'm really excited to have this conversation today about brain health and heart health and how those two things really connect to our overall mental well-being.
Awesome. Thank you. Well, thank you for being here.
Hi, yes, I'm super happy to be here as well. My name is Dr. Kacie Deters. I'm a neuroscientist by training and a professor and researcher currently at UC Los Angeles. My lab focuses on looking at different risk factors for Alzheimer's disease and cognition, focused on the Black community. During my training, I recognized that the Black communities are really underserved and in research, and so I was able to switch my training and really focus on predictors for that.
Oh, awesome. Well, I know that you all put together an amazing slideshow presentation, so I can't wait to see it. But before we jump into it, can you tell me why doing this panel is so important to you all?
Yeah, well, for me, a number of reasons. As a nurse, I definitely did not learn about that brain, heart, mind health connection. I really had no real understanding of how cardiovascular health even was connected to dementia. And so I think that the more that I learned about this topic, I realized that, well, one, we're having the conversation too late in life, and two, we need to get this information out to more of us. And when I say us, I mean Black people, because we suffer the most, have the highest risk factors for developing dementia and Alzheimer's disease. And we seem to think it's because, we don't talk about it soon enough. And so it's really important for me to have this conversation now to folks who are 30 and 40 years old instead of waiting until we're 60, 70, and 80. And there's really not a lot that we can do to change our risk factors.
Awesome, thank you. And what about you, Dr. Deters?
I don't even know what I can add to that. That was pretty much that was spot on. The only extra thing I can just add is, coming from the research perspective side, it is so critical that research is communicated effectively and that the research is done equitably. And so I'm really here to just talk about that aspect as well.
Yeah. And I'm going to add something that I think another reason why we're here is because I think it's important for folks to see people like Dr. Kacie Deters. She is a neuroscientist at UCLA and a beautiful Black woman. And I think we need to see that. I think folks need to understand that behind the scenes doing the work are people that look like us, because when you see it, I feel that then you feel you can achieve it. So I'm going to give her kudos while I'm on stage with her.
I am so excited to hear it. I mean, I'm from Houston. I'm not sure if you all are familiar with the medical system in Houston, but growing up, it was always so easy for me to find a doctor that I love and that was a Black woman or male. But here it's been such a struggle for me. That's been one of my biggest gripes about living in LA. I still don't know who I want to go to as far as an OBGYN, right? Or who do I trust with my children? I'm still figuring it out. So shout out to you both for the work that you do.
Thank
and again,
you.
we're so excited to have you. So you gave me some really amazing facts. So 7 million people are currently diagnosed with Alzheimer's disease, and 1 in 3 people will age into some form of dementia by the age of 65. Why is this important data? And if you want to jump into the slides simultaneously, of course, feel free.
Well, I think that's important data because when we think about 1 in 3 people are going to age into some form of dementia, So as I mentioned, we're aging. And so what does that mean? Well, we know Alzheimer's disease, there's not a cure for it, but folks don't realize there are over 100 different types of dementia. And there are things that we can do to minimize our risk as we age. And so we look at the prevalence of Alzheimer's disease currently, and if we don't make some differences, that number is expected to jump to 13 million by year 2050, which is right around the corner. Additionally, we're looking at the astronomical costs of having to deal with Alzheimer's disease and dementia in our communities. And we know when it comes to costs, that those costs hit us hardest in communities of color, in communities that have maybe the Medicaid or Medi-Cal system, right? And so we want to address these issues early so that we can minimize the risk that it has on us as a people, but also the burden that it's having on our healthcare industry as a whole.
No, I love that. I can't tell you how many times I've heard someone say, oh, I feel like this person is showing early signs of this or that, and they're trying to talk to them about it, and they're like, oh, I'm fine, like I don't have any issues. Or what do you mean, I just forgot something, you know?
Right. And that's usually the conversation Kacie and I see, is we're talking about signs and symptoms earlier in the conversation, but nobody realized that they're signs and symptoms. So we're saying, oh yeah, this person is forgetful or confused, or we're seeing behavioral changes, but we're not doing anything about it. And then later on, when they're about 60, 65, then they're starting to go getting a cognitive exam, they're realizing that, oh yeah, they do have some signs of dementia or Alzheimer's disease, but by then, some of the things that they could have done to minimize their risk have already passed them by.
Yeah. So I know you said that there's over 100 types of dementia. Can you break this down for me and talk about the different types?
Yeah, well, I didn't realize that there were so many different types of dementia, either as a clinician, but there are over 100 different types of dementia. Now, Alzheimer's disease is the most prevalent, and then next we have vascular dementia. And vascular dementia is the one that I think we don't talk about enough, especially in the Black community, because that dementia is directly correlated to our cardiovascular health. And so diseases such as high blood pressure, diabetes, heart disease, and obesity. And so when we think about that, when we think about, oh, okay, if this particular type of dementia is related to these particular types of diseases, well, what if we minimized our risk for hypertension, right, diabetes, and obesity? Would we then be minimizing our risk for cardiovascular disease, and then vascular dementia? So that's one of the ones I think we don't talk about a lot. Then also there are dementias that are caused by things that can be reversed. So you could have confusion related to medication toxicity. You can have confusion and behavioral changes related to urinary tract infections, but also things like depression and anxiety, isolation. These are all things that are contributing to our mental well-being and overall dementia risk. And so it's those reversible types of dementias that we like to talk about, and also that vascular-related dementia that I think it's really important to discuss in the Black community.
And just to add just a smidge to that, all of those are so critical, but they happen earlier than 60, 65 once you get to the doctor's office and you start to actually realize these. Alzheimer's, for example, all of these things occurred decades before. And so it's really important that we start as early as we can.
Right. What are some early signs that we can look out for?
Wow, there's so many. I'll name the one I know that's most common, and maybe you want to add one on there, Dr. Deters. Forgetfulness to the fact that it's affecting your day-to-day activities. And so some people laugh and joke and say, oh, I forget where I put my phone, or I forget where I put my keys. And that's normal. We're busy folks. But when it's affecting your day-to-day activities, meaning that you forget where you put your phone and you can't remember, recall, or retrace. So you have a phone, you put it down, and you can't say, oh, I walked in, I went upstairs, I went in the bathroom, oh, let me do that, and there's my phone. Then that may begin to affect your day-to-day activity. And also, if you're unable to recall what that phone is for, so if you're putting the phone in the cupboard, putting the phone in the refrigerator, it's because you may have forgotten at that moment when the phone is in your hand what it's actually for. So that's one of the symptoms that people see early on, but they kind of laugh it off, especially in the Black community. And I think that's something we say, hey, hold on, maybe something's going on with me. And it doesn't have to be Alzheimer's disease. It could just be some form of dementia causing some confusion.
Oh, I love Dr. Deters, do you have anything to add to that as far as signs?
No, I think those are the earliest signs to focus on. I think it's just, speaking to the vascular health in your middle life, it's just, those are some factors that we can actually start to change to reduce the risk.
Yeah. No, I love that. Well, in regards to that, so studies show a direct correlation between brain health and cardiovascular diseases such as high blood pressure, as you mentioned, diabetes, and obesity. So can you explain this a bit more, and how does it correlate to mental health? What's the correlation? I know you've already started talking about this, but now we're going to take a deeper dive into it.
So as a nurse, I look at it this way. I always say, does food predict your mood, or is mood predicting your food, right? And so we know that, and this is just a conversation always in the clinical world, that Black people are at higher propensity for all chronic illnesses, right? So high blood pressure, diabetes, obesity. And Dr. Deters is going to talk a lot about the social determinants of health that are connected to that. So just on the clinical side of it, why are we more prevalent to these diseases? Well, one of the reasons is the food that we eat. And so when we think about food and mood, I always think about if you're depressed, if you're feeling anxious, if you're feeling lonely, emotions are connected to what we eat. And often the food that we choose are foods that make us feel comfortable, right? You can take that all the way back to slavery, right? We were given particular things to eat that didn't taste well, and so we had to add lard and batter and all these things on them to make them taste better, and that was comfort food, right? And so now when we're not feeling well, when we're anxious, when we're depressed, when we're sad, we reach for food that's probably not the best for us, right? So we're reaching for foods that are high in saturated fats, right? We're getting foods that are high in sugars, carbs, fried foods, high in salt and sodium, and so that directly correlates to our cardiovascular health. So those foods that we're eating because of our mood increase our risk for high blood pressure, diabetes, heart disease, and obesity, and they'll directly correlate to our overall brain health. So that brain physiology begins to change based on the fact that we're not getting good nutrients and hydration to our brain. And so I try to encourage folks to think about the things that they're eating, not to their physical appearance, but start thinking about your mental overall appearance, right? Because this, you can dress this up, but you really can't change what's going on up here. And so I think we have to start thinking about food and mood and how they correlate.
No, I love that you said that. And as I mentioned, I am from Houston, so I'm a Black woman from the South. And I'll never forget when I told my family, like, oh, I don't eat beef and pork anymore. It was like, what? Like, you don't eat beef and pork? And now I'm pescatarian. And I think now my family is starting to really understand, okay, like I've seen them grow tremendously in terms of being just really mindful about the things that they consume. But there was a time where it was like, what do you mean you're not going to eat this? Or you don't want sausage? And it's like, well, I mean, if that's what you want to eat, that's fine. But I'm trying to do better. So I love that you spoke on that. Okay, awesome. So like with most diseases and chronic illnesses, and as you mentioned, Black people always seem to carry the highest risk factors. What are the statistics for dementia and why?
So what really made me get really involved into this disease was when I found out that Black women carry the highest risk burden. So 2/3 of folks who have dementia or some form of dementia are women. And then Black African Americans are twice as likely to develop some form of dementia than their white counterparts. And so I was like, hey, hold on, I'm a Black woman. And I did not know that. And I don't think a lot of Black women do know this. And so we know the reasons why when we look at some of the risk factors, and especially when Dr. Deters starts talking about stress and trauma. But to me, we still need to know why so that we can start doing some things about it. And so those stats are what they are. And if we don't continue to have these types of conversations, Lauren, then those stats will not improve.
No, I love that you're talking about stress and trauma too, because in our previous panel, we talked about using healthy ways to alleviate stress and being mindful of the things that you do in order to pour into your own wellness. And I know some people, when they get stressed, they smoke cigarettes or they do this. I mean, to each their own, right? But finding healthy ways to cope with your stress is a key component of that.
Exactly.
Well, thank you. So, Dr. Deters, I would love to know, when it comes to the social determinants of health, can you share with us how the Black population in Los Angeles County is affected? And specifically, can you talk about how that's broken into like a map?
Yeah, certainly. So social determinants of health, you can think of these as just non-biological factors that are impacting our health. And so there's a number of different ones, education, quality, and length. There's socioeconomic burdens. There's income. It could be how many people you live with. It can be environmental factors, access to healthcare, and quality of healthcare. So all of these factors actually directly impact our cognitive health even later in life. And just getting to the first part about how does that impact the Los Angeles community. So there's something called like a neighborhood disadvantage score that we use in our research. So all of those factors I just talked about, social, economic, and environmental, we can actually combine those in various different ways. It depends on what you have access to. And to create this, again, this disadvantage score. And if you can see the screen, perchance, you'll see that Los Angeles area is really hot red orange. That is more disadvantaged, and this is in relation to the country. So this is suggesting that even here in Los Angeles, we just have this higher burden of things that can be changed, right? Again, these are social, environmental, economic. These are things that may have been stripped from us in the past that we're still trying to make up for that are actually impacting our cognitive health later in life.
Yeah.
Gosh, and I mean, even kind of going back to the topic, what I said in terms of finding good health care, like access to health care, finding doctors that you trust or feel comfortable with, on top of that, it just takes it to the next level. Can you dive a little deeper into the SDOH and how they correlate to the stress and trauma outcomes of people of color? And then also maybe if you can explain again what SDOH is.
Yeah, so social determinants of health. And so we can just say social factors for short. I just think that's a lot easier than saying social determinants of health.
I was like, SDOH.
Yeah, we'll just say social factors again, like just non-biological factors that are impacting our cognitive health. And so in general, one of the things that we do study in our lab is how racism and discrimination impacts cognitive health later in life. You can obviously imagine being a Black person in America and the discrimination that you faced across a lifespan, how that stress affects not only you physiologically, but also mentally. You can have hormonal releases, and these can also cause changes to your body that later in life that build up over time and will cause damage to your brain, leading to abnormal, cognitive functioning. And so that's just one of these aspects. These are things that we may not realize how important just our life, period, from growing up actually impacts our overall mental and brain health.
Oh my God! And when you think back, for me, my mind kind of goes to thinking about like slavery or those that lived right after slavery and what they went through, and then how their lives could have been different. I mean, aside from what they went through in terms of trauma, but just taking care of themselves and the mental. Oh gosh. Ugh.
Right. And I think it always also speaks to when we talk about why Black women are in the highest risk factor. I think about who worries when their husbands and sons and brothers go out of the home just to go to work, or go to school. Where are they coming back? Who worries about the school systems that our children grow up in, usually Black women, who's usually the most educated and the least paid, Black women. So when you think about the things Dr. Deters is mentioning, it makes sense combined with all the other things of why Black women carry the highest risk burden for dementia.
Well, we know only 20% of our well-being is directly correlated to clinical interventions. Can you break down the other 80% and why these areas are so essential to our mental health, and how can they minimize our dementia risk as we age? I know it's like a two-part question, but
yeah. So in general, we've been talking about how we can actually prevent dementia, or at least hope to stave it off. And so a lot of these socioeconomic factors we're talking about, whether it be, again, just income, access to health care, social environment, all of these things, again, are modifiable. I think that is the one thing that I want to stress, and one of the things that I try so hard in my lab. The work that we do actually could have the potential to impact policy. If we don't have policy change, unfortunately, life is going to remain. We really need people on our side, and in order to get people on our side, we have to, unfortunately, prove it over and over again, not even just once, but over and over. So showing that how, especially for Black communities, so many of these factors can actually be changed with intervention. Again, just something as basic as equal access to education, quality education, can have such a profound change later in life. And so all of these are just, again, modifiable, changeable factors, and including things like diet, right, and exercise. These are just things that we were, mentioning. All of these things, if we can change them, from early life to midlife to late life, we can have a better outcome.
And we look at the things that are modifiable and also ask ourselves do we need support from community leaders, council members, to make some of these things more modifiable? Because it's easy to say, you can get out and go walk, right? And walking is something you can or cannot do, But do we have green spaces in our communities, right? So it's easier for some folks to get up and go out and exercise, and not as easy for others to do so. I did a windshield study where you get in your car and drive through the community at the area around Martin Luther King Hospital, which is here in Los Angeles in the inner city. And I couldn't find any really healthy grocery stores. There's not a 24-hour fitness. There were a lot of liquor stores. There were a lot of little corner marts. There weren't clean areas to really walk around with your family. So those are things like Dr. Deters is saying, we need policy change. We need to have equal access to things so that those numbers will change, and that 80% that we're showing on the screen that really matters to our overall well-being is being actually equitably addressed.
No, well, thank you for sharing that. And I know there's some specific mental health conditions that have been proven to increase our risk for dementia. Can you talk about some of these, and then also talk about why seeking help or making lifestyle changes can make such a huge impact?
Yeah, so a couple that we talked about were depression, anxiety, and loneliness. And we have some information on the screen, but for those who can't see it, folks who suffer from depression have a 2 times increased risk for developing some form of dementia. Those with anxiety have a 20% increased risk. And this really got me was loneliness. Not folks who are alone, because there's a difference between being alone and being lonely, but folks who identified that they were suffering from loneliness have a 40% increased risk. And so it let us know that mental health is important. Getting support is really, really important. And understanding that you may be in a space that is new to you. And so I say that when I think about loneliness. Sometimes we age or lifestyle changes put us in that loneliness window, right? You could retire from work or move to a new city, or your kids leave the home, or maybe a spouse, you get divorced, or a spouse passes away. And you don't realize that now you are having increased isolation and these new feelings. So I think we really have to look at our emotional overall well-being and really understand that seeking therapy can really help us and lower our dementia risk. And the last part is about misdiagnosed mental illness. We know that sometimes folks in our community are being diagnosed with bipolar disease or schizophrenia or other things, and it's really maybe early onset dementia, but they're not getting a diagnosis. They don't know that they could have early onset dementia, so they're not even going to their physician and talking about it. And doctors are ignoring some of those signs in us and just giving us a blatant diagnosing and then incorrectly medicating us, and we have poorer outcomes. So I think understanding that connection between those mental health disorders and overall brain health and those outcomes are really, really important.
No, I love that. And I know that you all would love to share 10 ways to love our brains. So I'm excited to hear more about those.
Oh, yeah. I think before that, we do have some information on just what it looks like to get a brain study done.
Oh, exciting.
Because some folks really get a little leery on that. So Dr. Deters is going to share a little bit about what happens in our lab.
Yeah, I'll go through this super briefly, but it is really hard to identify risk factors for dementia, cognitive decline, specific to our community if we don't come in and we aren't part of the research. And I fully understand why our community doesn't want to come in and be a part of the research. And again, this is one of the reasons why I'm here, to just try to share a little bit of information about like participating in an imaging study, for example. So again, if you're able to see the screen, but I will still describe it. Brain imaging, there's 2 different types we use. One is a MRI, I'm sure a lot of people have heard about an MRI. You just go into a scanner and it can just look at the structure of your brain. And there are certain areas that shrink over time due to our neurons that are dying. And so you can actually see this in an MRI. And so that's on the bottom left of the screen if you're able to see that. And so you can also see the shrinkage in the Alzheimer's brain there. So one brain is full of gray and white matter. Those are the neurons. And then the brain on the right, you can see it's a lot smaller because the neurons have died and the brain has actually shrinks due to that neuronal loss. And so I just wanted to show these images so people can kind of see what we see in research and how we're able to use that to further help identify predictors or risk factors for dementia and cognitive decline. And those neurons I'm talking about is that funny looking structure on the right that kind of looks like a tree. That's a neuron, and there's just some proteins around there. And when we get dementia, these proteins become abnormal, and they can start to accumulate when they're not supposed to accumulate. And so we can actually measure that protein accumulation in our brain as well, and that is what you see on the right. So, for example, that blue brain, or purple, I'm not sure which color you see, I see both, but that blue or purple brain is a normal, healthy brain without any abnormal protein buildup in our brain. But you can see the brain on the right has a lot of color, green, yellow, and that is signifying protein buildup. And again, that is somebody who has Alzheimer's disease that has a lot of abnormal, it's called amyloid protein, in the brain. And so, again, all of these are really safe, very minimal adverse events that can happen to you. But I just wanted to share a little bit about what these actual research that we do in the lab and what it is and looks like.
Thank you for that, Dr. Deters, because I think that's so important because we're so afraid of research, but we need that to happen. And so I think, again, it makes a big difference coming from someone who looks like us, describing research that's for us.
No, I love that. Okay.
So getting into those 10 healthy habits for your brain, that if you go to our website at the Alzheimer's Association, you can download this information, or I can share with anyone who needs it. But there's probably just a couple that we have time to highlight. For me, I always highlight the sleeping well. We always are told to sleep, get that good 7 to 8 hours of sleep. But it wasn't until I really started looking into a lot of research surrounding dementia and cognitive decline that I realized how important sleep was. It wasn't until recently that I realized our brains had a little bitty, what we call I call it a washing machine. I know there's a scientific term, but I call it the washing machine in our brain. And so when we're sleeping, we're in that deep REM sleep, rapid eye movement sleep, is when our brain does this thing where cerebral spinal fluid and all this other stuff happens and the toxins are being washed out of our brain. But it only can happen when you're in deep sleep. And I did not know that, and I don't think a lot of other folks knew that. And so we nap a lot, or we do 4 to 5 hours, and we think we're good. But we need that deep sleep so that our brains can wash out some of those toxins, and when we wake up, we feel refreshed. That's why. And so I have really made it part of my journey to work on getting natural, not the NyQuil or ZQuil version of sleep, because you need that function to happen to help wash out some of those toxins and decrease your risk for cognitive decline. So mine is always going to be about sleeping. What about you, Dr. Deters?
I think out of all of those healthy habits, the one that I actively do now is working out. I do not enjoy it at all. I hate moving. But I know how important working out is to just overall health. Body health, mind health, dementia risk. It's just overall benefit. And so I force myself to move at least 3 times a week, even just in my house. There's so many YouTube videos out there that are for free, and I just hop on with somebody and do the motion, I like the dancing ones. That's a good way. Find something you like, though. That's a real key, is finding, you don't have to do all these habits. It's hard. We all got lives, but find something that you can do to make that change.
I love that. At least 3 times a week. I'm working on that.
I am too. One that I find interesting is that you all have Stay in School, which I would imagine is just about keeping your mind sharp and moving and thinking of things.
Yeah, we know that study shows that learning new things, keeping your mind sharp, as you're saying, really decreases your risk for cognitive decline. And so it's really important, folks that are listening here today, you're learning new things, so you're helping. But yeah, definitely staying in school. It doesn't mean to get your master's or your PhD. You could just be going to school for art or going to school to learn a new language or taking up an instrument, but something that is new and challenging for you.
I love that. Well, before we wrap up, and then I also want to see if we have a couple of questions that were thrown in the chat since we are live streaming. What advice would you give for someone who feels like they may be experiencing early signs, or let's just say their family members experiencing early signs, but they don't want to go to the doctor? Like, what advice would you give to them?
Yeah, you start with your community or your family. Talk to somebody. I think that's a key, and that just goes for overall health, period, mental health. Just talk to somebody. Find somebody, whether it be the pastor at your church, again, a spouse, a sibling. Just talk to somebody. I had a friend who was sick, talked to me because she was nervous to go to a doctor, and I went with her. It's just those small little starts, just to have somebody, hold your hand, because sometimes we do need somebody to hold our hand. And so I would just say, just find someone that you can talk to. It is really hard, but that's a really great first step.
No, that's wonderful advice.
And I would add, if they're afraid to go to the physician, we totally get that. But maybe start keeping a little journal of some of the things that they're noticing. Keeping a journal, the last 2 weeks I've been feeling more confused, or, last month I couldn't remember where I put my car keys. Keeping their own little journal of things that are happening, because that will empower them when they do finally speak to a physician of, these are real things that are happening to me. Because a lot of times they don't want to talk to a clinician because they're not believed, they're dismissed, But when you go in there with those facts, and then with someone that is supporting you and you feel comfortable sharing those facts with, I think then you're armored, you're empowered to say, no, this is really happening, and I need to know what some good next steps will be.
No, awesome. Well, thank you both so much for that. So I didn't know if we have any questions that were thrown in the chat. Oh, we have a question in the audience. Awesome.
When you talked about deep sleep, what if you're someone who has trouble sleeping? Thank you. How do you get that deep sleep, or how do you make sure that you're getting that deep sleep, since that's so important? The natural sleep.
Yeah, I'll give you my version and see if there's more scientific ways of doing this. I think that the thing I tell folks is to figure out a routine. That routine before going to sleep is really important, and it's very challenging. I was a mom, I had 2 kids, my husband recently passed away, but I was married, so I knew about married life. I was in school working, so a routine is like, oh yeah, girl, that's not for me. But finding a routine does work. So I now know that I have to put my phone on the charger, that starts, and I put my TV on the timer, because I love the TV to be on. And I don't have certain things past a certain time. And so just those few things helped me started going to sleep easier and then staying asleep. The other thing that I've done is when I was waking up, I didn't turn on the TV and I didn't go get my phone, and I was allowing myself to go back into sleep. Because sometimes you may have insomnia and wake up and you're like, oh, I need to do something. So routine for me, and then when you do wake up, just be still and see if your body can go back into that sleep. Anything you want to add to that?
I think that's pretty good. If you have a busy mind, journaling is actually really helpful. And again, that's just for mental health purposes as well. But oftentimes we're awake at night because we are stressed out about life, about things. And I have a therapist, an amazing one. I've had one for such a long time because I do care about my mental health. And that is one of the things that was suggested to me. And do I do it every night? No. But when I can't sleep, I do journal, and it helps to get everything out. Also, I live under the flight path for LAX. And so I have a air purifier that kind of has like a white noise. And so I also turn that on, and that also really helps me. Again, it's trying to create a peaceful environment for your sleep, by whatever means necessary.
Okay, awesome. Well, thank you so much, Tia and Dr. Deters. It was so wonderful having you both here, and I hope that everyone, whether you're in person or via live stream, that you learned something new today. I know that I learned so much, and let's just take care of our minds and our hearts, and go to the doctor, get those checkups. So thank you.
Thank you for having us,
Thank you.
Lauren. Thank you so much.